In this video, we will discuss about Strongyloides stercoralis. It is also known as the threadworm. What is Strongyloides stercoralis? Threadworm is an intestinal nematode that causes strongyloidiasis in humans. Epidemiology of this worm. Threadworm occurs primarily in the tropics, particularly Southeast Asia. Its habitat is similar to hookworms, because the same type of soil is required for its growth. Route of transmission. Threadworm enters humans by only one route. Skin penetration by filariform larva. Filariform larva is an infectious form of worm. Risk factors. Walking barefoot on soil, in warm climates with poor sanitation, increases the chances of being exposed to threadworm. Life cycle of threadworm. Its life cycle is complex. It has two life cycles: the parasitic cycle, inside the human; the free-living cycle, outside the human. First, we will discuss the parasitic cycle. Parasitic cycle of threadworm is similar to hookworms, except that threadworms have the ability of auto-infection. Steps of the parasitic cycle are: filariform larva penetrates the human skin, they enter the bloodstream, they migrate to lungs, and enter the alveolar spaces of lungs. They climb up to trachea, where they cause coughing. Coughing causes swallowing of larvae into GI tract. Larvae evolve into adults. Within the small intestine, adults produce eggs. In the mucosa of intestine, eggs hatch into rhabditiform larvae that are passed in the feces. They develop into filariform larvae in the soil. Filariform larvae penetrate human skin and enter human body. In this way, the parasitic cycle begins. Again, there is also the special phenomena of auto-infection in threadworms. In the small intestine, some rhabditiform larvae evolve directly into filariform larvae. Instead of leaving the body as rhabditiform larvae, these filariform larvae formed in the intestine directly penetrate the intestinal wall to enter the bloodstream. Through the bloodstream, they reach the lungs, and the parasitic cycle starts again. Second cycle is the free-living cycle. Rhabditiform larvae released from human feces into soil can evolve directly into male or female adult worms. Instead of maturing into filariform larvae, male and female adult worms mate in the soil, and the life cycle from production of eggs to evolution of rhabditiform larvae will occur in the soil. This cycle usually occurs in the human body in parasitic cycle. If these rhabditiform larvae transform into filariform larvae, then the parasitic cycle within humans will start. If these rhabditiform larvae transform into male and female adults, then the free-living cycle within the soil will start. What is strongyloidiasis? It is the infection caused by Strongyloides stercoralis. It occurs in two phases: acute phase, chronic phase. Acute phase. It occurs in three areas. In lungs, it shows as Loeffler syndrome. In skin, it shows as pruritus, also known as ground itch. It also occurs as cutaneous larva migrans. In GIT, it shows as abdominal pain and watery diarrhea. Chronic phase. In GIT, it occurs as intestinal ulcers, bloody stools and malabsorption in immunocompromised individuals. It occurs as hyperinfection and dissemination. Diagnosis. Following lab tests confirm it. Stool examination under microscope. It shows larvae, rather than eggs in stool. Because eggs are not released in stools, only larvae are. Differential leukocyte count. It shows eosinophilia. Serologic tests. It is positive for strongyloides antibodies. Treatment. The drug of choice is ivermectin. An alternate drug is albendazole.